So I'll usually get it to this point, and then I'll ask the patient, hey, would you mind just grabbing this and pulling it up kind of as high as you're comfortable with? Perfect, thank you, okay? And then with this one also, I like to cross it over like that before I wrap it around myself. That way it just clamps down on the leg a little bit better. I don't have to worry about it moving around too much. So, we'll start with internal external rotation. All you're going to do is provide a lateral glide. Okay? I'm going to get her into 90-90 position like this. I will make sure that belt's where I want it to be. I'm going to stabilize on the femur, close to the knee there. Give my lateral distraction, and then I can take her in and out of internal and external rotation. Again, I can have the patient do this actively, I can do it passively, whatever. Okay? So that's my internal external rotation. And then flexion extension is still going to be that lateral glide that I'm applying. Now, I'm going to just get that glide and then take her into extension and then flexion as far as we can go. Just again, applying and maintaining that pressure, that force throughout the entire movement.
Are you passively moving through it?
I am, but I could.
You could have her do it actively.
Right? And then now, I'm still applying pressure on the side there, just to go against that, or to provide counter force. But now she's going through that motion. Okay? So that's open chain for internal, external rotation as well as flexion and extension. For closed chain, typically it's just for flexion and extension. I'm going to have you stand up for me. And then we use our handy dandy stool again. Go and put your foot up there. And it's going to look a lot like the knee. But now we're applying more force at the hip, or well, all of our force at the hip. And then she's going to go into and lean into more flexion and then come back to neutral, right? We're already kind of in a little bit of flexion, but now we're just going to increase it. So we'll do the same thing, just go and pull that up tight. Thank you very much. Wrap around. And now I'm going to stabilize her pelvis as well as her distal femur, okay? I give that distraction, and then I have her go into and lean into it really far, okay? And lean that body forward as you go into the flexion. There we go. Okay? And just see how far she can go. Now we're not getting much, if any, true extension. We're not even really getting back to neutral, right? So if we do want to work on that extension, go ahead and take your foot off that step. Now, I'm going to do the same thing. I'm going to stabilize her pelvis, stabilize down here at her femur. Yep, you can go ahead and hold on there. Give that lateral distraction, and then she's going to step forward with her other leg and put herself into more extension, and then come back. Let's move that stool so you don't. So you don't. Okay. There we go. Nice and slow for me. Okay. There we go. So that's flexion and extension, with movement in closed chain.
So those first couple